If you're watching this, there's a good chance you've been told something like, "There's really nothing more we can do. Here's a prescription for gabapentin." Or maybe, "Just manage it. Try not to fall." Or worse, your doctor looks at the floor while you describe the burning, the tingling, the numbness that's stealing your sleep, your balance, your life. And they say, "That's just how neuropathy is." I'm here today to tell you that is not the whole truth. And in the next minutes, I'm going to show you exactly what's been left out of that conversation and what you can do about it starting today. We're going to talk about supplements with real clinical evidence behind them. We're going to talk about devices you can use in your own home that are FDA cleared for nerve pain. And we're going to talk about the kinds of clinics and specialists who are actually getting results with neuropathy patients, not just managing symptoms, but helping nerves regenerate. At the end of this video, I'll tell you how to get your hands on my complete neuropathy healing guide ebook, a step-by-step system that puts everything together in one place. So stick with me. Let's start by asking the uncomfortable question. Why doctors don't tell you? Why is it that the average neurology appointment for neuropathy lasts under 15 minutes? Why is the standard treatment pathway almost always diagnose, prescribe gabapentin or pregabalin, come back in 6 months? It's not that your doctor is bad. Most are genuinely trying to help. But conventional medicine runs on a system built around pharmaceutical interventions and billing codes. Lifestyle-based medicine, nutraceuticals, and functional approaches often aren't covered by insurance, and they take time to explain. Time most doctors don't have. There's also a knowledge gap. Most medical schools dedicate very little curriculum time to clinical nutrition, dietary supplementation, or integrative approaches. When a doctor graduates, they know drugs, they know surgery, they know how to diagnose. But they may never have studied whether alpha-lipoic acid can reduce neuropathic pain scores, even though there are dozens of clinical trials on it. This isn't about blaming doctors. It's about you knowing what questions to ask and what options exist beyond the prescription pad. And that's exactly what this video is designed to give you. What is neuropathy? Types and root. Before we get into treatments, let's make sure we're on the same page. Neuropathy, or more precisely, peripheral neuropathy, is damage or dysfunction of the peripheral nerves. These are the nerves outside the brain and spinal cord that carry signals between your central nervous system and the rest of your body. There are 3 main types of peripheral nerves. Sensory nerves feel pain, temperature, touch. Motor nerves control muscle movement. Autonomic nerves regulate automatic functions like heart rate, digestion, and blood pressure. When these nerves are damaged, you can experience symptoms like burning or stabbing pain, numbness or loss of sensation, tingling or pins and needles, muscle weakness, balance problems, sensitivity to touch. Even a bedsheet can feel painful. Common causes of neuropathy. Diabetes, the #1 cause. About 60–70% of diabetics develop neuropathy. Chemotherapy, chemo-induced peripheral neuropathy, or CIPN. Vitamin deficiencies, especially B12, B1, and B6, deficiency or excess. Alcohol use disorder, autoimmune conditions like lupus, rheumatoid arthritis, Sjogren's syndrome, thyroid disorders, infections, Lyme disease, HIV, shingles. Idiopathic, no known cause, accounts for about 30% of cases. Here's the key insight. Neuropathy isn't just one disease with one cause. The treatment approach that works best for you depends heavily on what's driving your nerve damage, and that's why a one-size-fits-all prescription often fails. Supplements for nerve healing. Let's talk supplements. And I want to be clear, I am not telling you to throw away your prescription medications. I'm telling you about tools that may work alongside conventional care, or in some cases address the underlying problem more directly. These aren't random internet cures. These are compounds that have been studied in peer-reviewed clinical trials for neuropathy specifically. Let's walk through them one by one. Alpha-lipoic acid, ALA, high energy. This is the star supplement. Alpha-lipoic acid is probably the most well-studied supplement for diabetic neuropathy in the world. It's a naturally occurring antioxidant found in every cell of the body, but in therapeutic doses it does something remarkable. It fights oxidative stress in nerve tissue. Oxidative stress is one of the major drivers of nerve damage, especially in diabetic neuropathy. Free radicals damage the myelin sheath, the protective coating around nerves. ALA neutralizes those free radicals and has even been shown to improve nerve conduction velocity, meaning it may help nerves actually transmit signals better. The clinical evidence. The Sydney and Aladdin trials, large, randomized, controlled studies, showed that intravenous ALA at 600 mg/day significantly reduced neuropathic pain symptoms. Oral ALA at 601,800 mg/day has also shown positive results in multiple studies, though the IV form tends to work faster. What to know before you start? Look for the R-ALA form, R-alpha lipoic acid. It's more bioavailable than the S-ALA or racemic mixture. Typical dose, 300 to 600 milligrams per day of R-ALA, or 600 to 1,800 milligrams of regular ALAA. Take on an empty stomach for best absorption. May lower blood sugar. Diabetics should monitor closely. Usually well tolerated. Some people experience nausea at high doses, bottom line. If there's one supplement to discuss with your doctor first about neuropathy, this is it. B vitamin complex, B1, B6, B12. This is an educational segment, nuanced. Important warnings to include. B vitamins are absolutely critical for nerve health, and deficiency in any one of them can cause neuropathy. But there's nuance here that most people miss. Vitamin B12. B12 deficiency is one of the most common and treatable causes of neuropathy, yet it's frequently missed, especially in older adults, vegans, and anyone taking metformin, a common diabetes drug. B12 is required for myelin synthesis. Without it, nerves deteriorate. If your B12 is low, supplementing can literally reverse neuropathy symptoms. Methylcobalamin form is preferred over cyanocobalamin for nerve health. Get your B12 level tested. Optimal range is 400, 800 pg/ml. Sublingual or injectable B12 has better absorption than oral for many people. Vitamin B1, thiamine, benfotiamine. Thiamine deficiency is a major cause of neuropathy in people with alcohol use disorder. But there's also a fat-soluble form called benfotiamine that gets into nerve tissue far more effectively than regular thiamine. Studies show benfotiamine may reduce neuropathic symptoms and protect against age, advanced glycation end product accumulation, a key mechanism in diabetic nerve damage. Vitamin B6, the double-edged sword. Here's the warning most videos skip. High-dose B6 supplementation, above 200 mg/day and sometimes even lower, can cause neuropathy. This is called B6 toxicity or pyridoxine toxicity. If you're in a B complex that has 50 to 100 milligrams of B6, and you're also taking it separately, check your total dose. Less is more with B6. Recommended, a balanced B complex with methylated forms, methylcobalamin, methylfolate. Avoid megadosing B6. Acetyl-L-Carnitine. Acetyl-L-Carnitine, or ALCAR, is an amino acid derivative that plays a fascinating role in nerve health. It's involved in energy production within mitochondria, and it also appears to support the growth factor NGF, nerve growth factor, which actually helps nerves regenerate. Several clinical trials have shown ALCAR reduces pain in diabetic neuropathy and chemotherapy-induced neuropathy. One study showed it was comparable to some prescription medications for neuropathic pain relief while simultaneously promoting nerve fiber regeneration, something most drugs don't do. Dosage and tips. Dose: 500 to 1,000 milligrams, 2 to 3 times daily. Best taken in the morning or early afternoon. Can cause insomnia if taken late. May take 3-6 months to see full effect. This supports nerve regeneration, which is a slow process. Note: do not confuse with L-carnitine or propionyl L-carnitine. The acetyl form is the one with evidence for neuropathy. Magnesium glycinate. Magnesium is involved in over 300 enzymatic reactions in the body, and it plays a direct role in nerve transmission. Magnesium deficiency, which is incredibly common, especially in diabetics and people taking certain medications like PPIs or diuretics, can worsen neuropathic pain and muscle cramping. Magnesium acts as a natural NMDA receptor antagonist, the same mechanism as some prescription pain drugs. It can help reduce hypersensitized pain signaling in the nervous system. Form matters. Magnesium glycinate is the preferred form. It's highly bioavailable and gentler on the stomach than magnesium oxide or citrate. Typical dose, 300 to 400 milligrams elemental magnesium daily. Omega-3s, NAC, and curcumin. Brisk pace. Hit highlights. Omega-3 fatty acids, fish oil, algae oil, anti-inflammatory omega-3 EPA, and DHA have shown promise in reducing neuropathic pain and supporting nerve regeneration in animal and human studies. They help reduce the chronic neuroinflammation that contributes to nerve damage. Look for high-quality fish oil with at least 1 g of combined EPA plus DHA per serving, or algae-based omega-3s if you're vegan. N-acetylcysteine, NAC. NAC is a precursor to glutathione, your body's master antioxidant. It's been studied specifically for chemotherapy-induced neuropathy, where it may help protect nerves from the toxic effects of drugs like cisplatin and Taxol. Growing evidence also supports it for diabetic neuropathy. Curcumin, turmeric extract. Curcumin's powerful anti-inflammatory and antioxidant properties have been studied for neuropathy with encouraging results. The key, you need a bioavailable form. Standard turmeric powder has very low absorption. Look for phytosome, nanocurcumin, or formulations with piperine, black pepper extract. Doses of 500 to 1,000 milligrams of a high-absorption curcumin taken twice daily show the most promise. Supplement. Summary: ALCAR, B12, methylcobalamin, benfotiamine, magnesium glycinate, omega-3s, NAC, and curcumin are the core evidence-backed supplements. Start with the ones most relevant to your cause and work with a functional medicine doctor to monitor labs. Section 2. Devices. What really works? Now let's talk devices. This is an area where technology has genuinely advanced, and there are FDA-cleared options that most people with neuropathy have never heard of, even though their doctor could technically recommend them. We're going to cover 4 major categories: TENS units, infrared light therapy, PEMF therapy, and vibration neurostimulation. Let's go. TENS units. TENS stands for transcutaneous electrical nerve stimulation. It works by delivering small electrical impulses through electrodes placed on the skin. These impulses essentially jam the signal. They interfere with pain signals traveling to the brain through something called the gate control theory of pain. When your spinal cord receives this competing electrical input, it gates out the pain signal. TENS has decades of clinical research behind it and is FDA-cleared for pain management. It's non-invasive, drug-free, and most units are available over the counter for under $50 to $200. For neuropathy. Specifically, best results with low-frequency TENS, 1 to 10 Hz for chronic neuropathic pain. This mode releases endorphins. High frequency, 80 to 100 Hz, works better for acute flare-ups and provides faster temporary relief. Electrode placement matters. For foot neuropathy, place around the ankle and calf, not directly on numb areas. Use 20-30 minutes per session, 1-2 times per day. Look for units with multiple programs and adjustable intensity. Brands like TENS 7000, iRelieve, or PowerDot are popular. Important TENS provides symptom relief but does not regenerate nerves on its own. Best used as part of a comprehensive protocol. Infrared light therapy. This one surprises people. Enthusiasm. Near-infrared and red light therapy, also called photobiomodulation or low-level laser therapy, LLLT, is one of the most exciting emerging areas in neuropathy treatment. And it has more science behind it than most people realize. Here's how it works. Certain wavelengths of light, specifically 630 to 850 nanometers red and near-infrared light, penetrate tissue and are absorbed by mitochondria. This increases ATP, cellular energy production, reduces inflammation, and stimulates nerve cell regeneration. The clinical evidence. Multiple clinical trials on diabetic peripheral neuropathy have shown statistically significant improvements in pain, sensation, and vibration thresholds after infrared light therapy. Some functional medicine clinics use it as a primary modality. At-home devices, red light therapy panels like Juve, Platinum LED, Mito Red, full body panels you stand in front of, targeted foot-leg wraps with red and near-infrared LEDs, handheld devices for targeted treatment, key specs to look for, wavelengths of 630 to 660 nanometers, red, and 810 to 850 nanometers, near-infrared, sufficient power density, irradiance of at least 30, 50 MWCM2O sessions, 10, 20 minutes per area, 3, 5 days per week. PEMF therapy. PEMF stands for Pulsed Electromagnetic Field Therapy. This one sounds a bit sci-fi, but the science is solid enough that NASA has researched it for astronaut bone and tissue recovery. PEMF works by generating low-frequency electromagnetic pulses that penetrate the body and interact at the cellular level. It improves cellular membrane potential, stimulates mitochondria, reduces inflammation, and has been shown to promote nerve regeneration by increasing nerve growth factor and improving blood flow to peripheral nerves. Devices. Full body mats like BEMR, Healthy Line, Oh My. You lie on them for 8 30-minute sessions. Targeted applicators for hands and feet. NASA-developed devices have been spun off into consumer products. These tend to be more expensive than TENS or Red Light, $300, $5,000 plus. What the research shows studies on PEMF for diabetic neuropathy show improvements in pain, paresthesia, and nerve conduction. It's also used in clinical settings for wound healing and bone repair. The same mechanisms benefit peripheral nerve tissue. Vibration therapy and neurostimulation. Vibration therapy, whole body vibration, WBV platforms, and localized vibration devices have shown interesting results for neuropathy. Vibration stimulates mechanoreceptors in the feet and lower limbs, which can help retrain the sensory system, particularly helpful when numbness has been causing balance problems. Studies show improved balance, gait, and reduced pain scores in neuropathy patients. Neurostimulation devices. Beyond TENS, there are newer neurostimulation technologies worth knowing about. Spinal cord stimulation, SCS, is a more invasive option for severe cases, but newer non-invasive options like the Rebuilder medical device, FDA-cleared, deliver complex nerve-specific waveforms designed to normalize pain signals in peripheral nerves. Some patients report dramatic improvements after consistent use. Device summary. TENS for immediate pain management. Infrared light for nerve regeneration and anti-inflammation. PEMF for cellular healing and nerve growth. Vibration for sensory retraining and balance. Used together as a protocol, these can dramatically change your quality of life. Clinics and functional medicine. Now we get to what I think is the most underutilized resource for neuropathy patients, specialized clinics and functional medicine practitioners who take a root cause, whole body approach to treatment. What a neuropathy specialist actually does. Not all neurologists are created equal. A neuropathy specialist, ideally a neurologist with subspecialty interest in peripheral nerve disease, goes beyond a standard EMG and nerve conduction study. They look at comprehensive metabolic panel to identify contributing factors, blood sugar, thyroid, B12, heavy metals, skin punch biopsy for intraepidermal nerve fiber density, the gold standard test for small fiber neuropathy, autonomic nervous system testing, genetic testing for hereditary neuropathies, detailed medication review. Many drugs cause neuropathy as a side effect. If your neuropathy has been poorly explained or inadequately treated, pushing for a referral to a neuromuscular specialist at an academic medical center can be a game changer. They may find a treatable underlying cause you didn't know existed. Functional medicine versus conventional treatment. Functional medicine takes a systems-based approach. Instead of asking what drug treats this symptom, it asks, why are these nerves damaged and what does the body need to heal? A functional medicine doctor working with a neuropathy patient will typically run an extensive lab panel, including organic acids, micronutrients, inflammatory markers, gut health markers, and heavy metal testing. Assess the gut-nerve connection. Leaky gut and dysbiosis are increasingly linked to systemic inflammation that drives neuropathy. Create a personalized supplement and dietary protocol based on your specific deficiencies and imbalances. Address root causes like insulin resistance, toxic exposures, autoimmunity, and chronic infections. Coordinate with neurologists and other specialists. Functional medicine isn't magic. But for people whose neuropathy has a complex, multifactorial cause, which is most people, it provides a level of investigation and personalization that conventional care simply cannot match in 15-minute appointments. Therapy and hyperbaric oxygen. IV delivery of nutrients bypasses gut absorption entirely, allowing much higher concentrations of key compounds to reach nerve tissue. Neuropathy-focused IV protocols often include high-dose IV ALA, 600 to 1,200 milligrams, the most studied IV therapy for diabetic neuropathy, IV B12, methylcobalamin, especially valuable when oral absorption is impaired, IV glutathione, the master antioxidant, supports detoxification and nerve protection, IV vitamin C, anti-inflammatory, supports collagen and myelin. These are typically administered at integrative medicine clinics or wellness centers. Costs vary widely, but a series of 10 infusions is common in clinical protocols. Hyperbaric oxygen therapy, HBOT, involves breathing 100% oxygen in a pressurized chamber. The increased atmospheric pressure drives oxygen deep into tissues that are normally poorly perfused, including damaged peripheral nerves. Studies on diabetic neuropathy and neuropathic wound healing show significant improvements with HBOT, particularly in patients with circulatory compromise. Many integrative clinics now offer soft chamber HBOT for at-home use, lower pressure, but more accessible. How to find the right clinic. So how do you actually find these practitioners and clinics? Here's a practical roadmap. Institute for Functional Medicine, IFM.org, has a practitioner finder for certified functional medicine doctors. American Academy of Neurology, AAN. Find neuromuscular specialists at academic medical centers in your region. Integrative medicine departments at major university hospitals often have neuropathy-specific programs. The American College for Advancement in Medicine, ACAM, directory for integrative practitioners who offer IV therapy. Ask specifically, do you have experience treating peripheral neuropathy with a root cause approach? If they stare blankly, keep looking. Telehealth has expanded access enormously. Many functional medicine doctors now consult via video, regardless of location. Pro tip: bring a detailed symptom journal, all your lab work from the past 2 years, your complete medication and supplement list, and a list of your specific questions to every appointment. Prepared patients get better care. The Neuropathy Healing Guide, eBook. Everything we've covered today, the supplements, the devices, the clinics, it all works best when it's part of a coordinated, personalized plan. That's why I created the Neuropathy Healing Guide eBook. This isn't a generic health guide. This is a comprehensive step-by-step system specifically designed for people with peripheral neuropathy who are ready to go beyond the standard prescription and start actively supporting their nerve healing. What's inside the Neuropathy Healing Guide? The complete supplement protocol with exact doses, forms, timing, and interactions to avoid, a device comparison guide, what to buy, what to skip, how to use each one. The 30-day neuropathy reset, a day-by-day action plan for your first month. How to talk to your doctor, specific scripts and questions to get the testing and referrals you need. Anti-inflammatory meal plan designed to reduce neuroinflammation and support nerve repair. Exercise modifications for balance, circulation, and nerve stimulation, safe for all fitness levels. The Clinic Finder checklist. What to look for, what questions to ask. Tracking templates to monitor your symptoms and progress over time. The link to download the Neuropathy Healing Guide is in the description below. If you've been suffering with neuropathy and feel like you've run out of options, this is your next step. Your action plan. Start today. I don't want you to leave this video feeling overwhelmed. So let me give you a simple starting point. Here's what to do this week. Step 1. Get your labs done. Ask your doctor for fasting blood glucose and HbA1c, B12 level, thyroid panel, comprehensive metabolic panel. These form the foundation. Step 2. Start with the big 3 supplements. Talk to your doctor about adding ALA, methylcobalamin B12, and magnesium glycinate. These three have the strongest safety and evidence profile and can often be started without a prescription. Step 3. Get a TENS unit. An entry-level TENS unit is inexpensive, safe, and can provide meaningful pain relief within days. Many people experience immediate improvement in quality of life. Step 4. Download the Neuropathy Healing Guide. Get the full roadmap so you're not piecing this together from random internet sources. Step 5. Find a specialist. Use the IFM Finder or ask for a referral to a neuromuscular neurologist. You deserve a thorough evaluation. You are not out of options. Your nerves can heal. The research shows it. Thousands of people have improved, often dramatically, by combining these approaches. It takes time, consistency, and the right protocol. But it is absolutely possible. If this video helped you today, if it gave you one new piece of information that changes what you do next, I'd be so grateful if you'd hit that like button right now. It helps more people in this community find the information they need. And subscribe, because we put out new content on neuropathy, nerve health, and evidence-based natural treatments every week. You don't want to miss what's coming. The link to the Neuropathy Healing Guide ebook is in the description. Click it, read it, use it. And if you have a question, drop it in the comments below. I read every single one. You are not alone in this. Take care of those nerves.